Hello. Our first lesson is looking into the culture of safety in radiation therapy. In this lesson, we will be reviewing the history of safety in radiation therapy and describing the current culture. Toward the end of the short presentation, I will introduce a few safety tools and programs that are part of the current culture and describe how they help protect patients from harm. There is a quiz embedded in the presentation, so be sure to listen carefully. As you know, the field of radiation therapy is just over 100 years old. Wilhelm Röntgen discovered radiation in 1895, and shortly after, in the early 1900s, physicians began using radiation for therapeutic purposes. I'm sure you have all seen the photos of brachytherapy sources being applied to the face in dermatology waiting rooms. Clearly, there was no regard or simply knowledge of radiation therapy safety protection at that time. It was not until people, including Röntgen himself, began to experience radiation burns that the power of radiation was realized. Shielding began being implemented in the 1900s. In the photo, you can see a number of booths and makeshift doors, as well as gloves and goggles to protect the radiation worker. Notice that there are few devices pictured to protect the actual patient. Now we practice the principle of ALARA as low as reasonably achievable and routinely wear shields and aprons to protect ourselves. We also shield patients in the diagnostic setting. However, we know that that is not effective in radiation therapy. Remember that we are employing photon energies of at least 4 megavolts, and the beam is meant to be penetrating. In radiation therapy, we employ multi-leaf collimation to protect the patient from unnecessary exposure. We also use techniques such as selective beam arrangements, beam weighting, intensely modulated radiation therapy, and volumetric arc therapy to ensure the dose is delivered to the tumor and not to the critical structures. Despite our routine efforts, accidents do happen. Two particular events drew the attention of Walt Bogdanich, who was a reporter for the New York Times. We will discuss those events in class in the next lesson. Nonetheless, Bogdanich published a series called The Radiation Boom in 2010. In this series, Bogdanich highlighted the dangers of radiation for the public. You can see some of the headlines here: radiation worries for children in dentist chairs, more protection for radiation patients, when when radiation treatment turns deadly. Obviously, this rocked the profession and sent professionals into a tailspin to respond to the headlines. Radiation therapy professionals in general were called to the stand in congressional hearings about the matter, and many professional societies published written responses. Two such responses were the document Safety is No Accident by the American Society for Radiation Oncology and Radiation Therapy Safety, the Critical Role of the Radiation Therapist by the American Society of Radiologic Technologists. Further, radiation professionals began to look at other fields, particularly human factors engineering, to reduce the number of radiation accidents. A few initiatives borrowed from industry are Kaizens, morning huddles, safety rounds, chart rounds, simulation reviews, A3 worksheets, timeouts, and good catches. We will discuss each of these in class and complete learning activities to better familiarize you with the tools and programs. Let's get to it.